going to talk about manual muscle tests in knee extension. And when we do this, we're really looking at the 4 quad muscles as they come down into your suprapatellar and then into your infrapatellar tendon, inserting on your tibial tuberosity. And the way that we're going to do this is again from 0 to 5. And a 0 is you ask them to try to extend their knee and you cannot see or feel any contraction of their quads whatsoever. A 1 is you ask them to extend and there's no motion, but you can see or feel some kind of contraction going on in these quad muscles. A 2, and again there's 2 ways to do a 2. The kind of cheater way, which is not supposed to be against gravity, but the way that sometimes we grade a 2, or if I'm in a hurry I grade a 2, is I would ask them to extend his knee, and he can do it some, come back down for me, he can do some, but he can't go through his full motion. So he's maybe moving a little bit, or the true way to do a grade 2 manual muscle test for knee extension is to have them lie on their side and start with a flexed knee, and then they're able to fully move it into an extended position. For a grade 3, again, you're going to keep with your stabilization hand and you're going to ask them to pull up their leg all the way into extension or straighten their knee, and they're able to do it without any type of resistance, and it's nice and controlled. A 4, again with your stabilization, you're going to resist at their distal tibia, not a lot, and they're able to hold it and it's nice and controlled. And then for a 5, you're going to apply moderate to maximal resistance. They can hold it at the top and then they come down and they're in nice controlled motion on their way down. And that last one is your grade 5. And again, as mentioned with the extension, you can ask them to go into internal rotation of their tibia or external rotation to focus more on the VMO or lateralis. But in general, just having them in neutral is your most common quad manual muscle or knee extension manual muscle test.